All right, for a little bit more on that, we're now joined in studio by Dr Sibongile Walaza, who's an epidemiologist at the Center for Respiratory Diseases and Meningitis, National Institute for Communicable Diseases. Thanks so much indeed for joining us, and welcome to the program.
Thank you for having me.
All right, so I think the one question people in South Africa want to know is, are we safe?
What I can say to you is that South Africa is prepared to detect new cases. So we've already put measures in place to identify and to respond in case we do have a case.
Have any been reported at all in South Africa so far?
In South Africa, we've not had any cases, or even in Africa as a whole, there have not been any cases of the novel coronavirus.
All right, so at this stage, what kind of precautions are you taking?
So from our side, I think the main thing is for us to put measures in place so that we're able to identify, to detect cases as soon as possible, and then we can act swiftly. So what we've done is we've developed, together with the Department of Health, we've developed guidelines for clinicians, nurses and doctors, also and case definitions, so that they're able to know what to look out for, which patients to look out for, and what to do when they get the cases. So that also when the patient, if there's an imported case that comes to a hospital, that the hospital knows how to manage that case, and they're able to isolate the case whilst they're waiting for the results.
I know at the airport that we already do some kind of temperature screening, and I suppose that this helps in trying to track down this kind of thing.
Yes, that's true. So South Africa does have screening at the airports, and it's one of our surveillance that has been there for a number of years. So with that, then we'll be able to screen patients, and then what we've then done is just to highlight heighten the awareness for the people who are working in those areas, just to make sure that they understand the case definitions, they understand where cases could potentially be coming from, and then they'll be able to pick up cases where they come through.
All right, tell us a little bit about this virus. Is it a new one? Has there been anything like it before?
So this type of coronavirus is new, but then coronaviruses is a large family of viruses, and then these they happen everywhere, and they call the corona because corona is a crown, and because of the structure of the virus, especially when you look at under the microscope, it has spikes on the ends that looks like a crown, hence the name coronavirus. So these viruses affect animals and humans, and they can cause diseases in animals and in humans. But sometimes it happens that a coronavirus that previously affected and caused diseases in animals, that it changes its genetic structure, and thus making it possible for it to then infect humans. When that happens, it will be the first time that it's affecting a human being and also then causing disease. Then it looks like that's what happened in this situation. And then when it is new, then we call it the novel, and then it's a coronavirus. So in this case, it is the novel coronavirus.
We're hearing reports that it could already be mutating.
So it's still early, and investigations are ongoing. So at the moment, the information, I mean, as any new virus that comes in, we have to look at what's going on. So still, they're still having a look at to see how does it affect others, and how does it change its structure.
And do we know how it works? I mean, it seems from getting infected that it can be fatal quite quickly.
So for this current one that we have, as I said earlier, that the information still is limited, but we know that there's a number of cases, especially in India, I mean in Asia, but then some identified cases out of Asia. And the majority at the moment of the cases that have been diagnosed or they've been identified have got mild illness. However, we do have serious cases, but the ones serious cases, most of them have had an underlying illness, another illness that they had, or it's an elderly person. And then we do have the deaths as well, but in most of the cases, people have had underlying illnesses. So the spectrum of the disease at the moment, we're still trying to establish that, but it does seem like most of the cases have a mild
Is it
presentation.
treatable?
Coronaviruses don't have a specific treatment, and there's no vaccine to protect individuals from getting it. But until the treatment at the moment is supportive, so they will be managing what the patient presents with. So if it's a respiratory failure, so we'll manage that problem.
So what should we look out for in terms of perhaps if we're worried about certain symptoms, what might they be?
So at the moment, I mean, what you're saying, especially to South Africans, especially if they're going to travel, then just to be aware when they go to areas where it's known to have been cases. For example, I'll use an example in this case, as in China, especially when in China, in Wuhan, that people avoid contact with sick people, and also just to practice respiratory etiquettes, that when they're coughing, they cover the coughs and things like that. And the patients who have been identified, that have been described already, most of them present with respiratory illness. So they'll be having coughs, fever, and some of them have got lung infection. So there's again a wide spectrum.
All right, and because you kept mentioning the word respiratory, does that mean it can only come through the mouth and the nose?
So when I'm saying respiratory, when I'm saying like still looking at it, is one of the things. So other respiratory conditions is that then it's, the transmission would be from respiratory droplets or contact. But for this virus, we still are needing to establish what is the mode, because with all new viruses, we have to do that exercise. But in terms of presentation, most of the cases have presented with the...
All right, okay. Are you working with neighboring countries to manage this?
So as part of this, South Africa together, NICD together with the National Department of Health, we are monitoring the situation and in terms of the number of cases. And yes, we are working with other partners in terms of having discussions with the other partners like the CDC and the World Health Organization.
All right, so not to worry too much at the moment, but be careful. Stay away from people that are not well and perhaps have respiratory issues for the time being.
Yes, but then important thing is to say that at the moment in South Africa we've not had any cases, and the cases that have been described are cases that have been in contact with the wild animals, or mostly in the market, or they've been in contact with sick people who come from the area where the market was identified.
And the best bit of what you told me is that we're prepared, which is good news.
Yes, South Africa is prepared to respond. Yes.
Dr. Walaza, thank you very much indeed for sharing your thoughts and insights today.
Okay, all right, thank you.
All right, we're going to take a quick break, and when we come back, we'll have